Hello doctors, in this video we will be covering the topic hyperthyroidism. As the name suggests, hyper that means having too much and thyroid refers to thyroid hormones, that is excessive thyroid hormones. Now let's see its root, that is pathophysiology. Here we have to focus on these two words. First, TRH and TSH. TRH, it is thyrotropin releasing hormone released by hypothalamus, and thyroid stimulating hormone released by anterior pituitary. Now, normally what happens? Hypothalamus, located at the base of brain, detects low levels of thyroid hormone and releases thyrotropin releasing hormone in hypophyseal portal system. Now this is a new word. Let me tell you about what is hypophyseal portal system. It is a link between hypothalamus and anterior pituitary, and likewise anterior pituitary then releases thyroid stimulating hormone, and this thyroid stimulating hormone stimulates thyroid gland. Further, thyroid gland is made up of 1000 follicles, about 1000 follicles lined with follicular cells. Follicles contains thyroglobulin. It is a protein found in follicle. After variable period storage of this protein in follicle, follicular cells converts this protein, that is thyroglobulin, by proteolysis in 2-iodine containing hormones, T3, triiodothyronine, and T4, that is thyroxine, and enters in circulation. Hence we see levels of T3 and T4 in blood. Now it's time to see functions of T3 and T4. First, T3. This hormone regulates your body temperature, metabolism, heart rate, digestive function, muscle control, brain development and function, and maintenance of bones. It also activates sympathetic nervous system responsible for fight or flight response. Likewise, T4 hormone. This hormone regulates weight, muscle strength, body temperature, and even your mood. Both this hormone also leads to increase in basal metabolic rate, helping in energy regulation in body, and is also involved in calcium metabolism. All these normal regulations, metabolisms, functions. What happened if this all increased? Means T3 and T4 increased. First, due to increased basal metabolic rate, energy regulation is increased. Body burns up extra food without using it for anything. I repeat, body burns up extra food without using it for anything except for heat. Body is producing more heat. Hence, we get our two clinical features. Despite of increase in appetite, first is weight loss and second is heat intolerance. Due to sympathetic nervous system effect or fight or flight response, heart rate increased, sweating, hyperactivity, anxiety, insomnia may occur. And due to sympathetic overstimulation of muscles that control eye movement leading to widened eyes, termed as exophthalmos. Then, ongoing hyperthyroidism for long time may lead to risk of congestive heart failure and osteoporosis. There is one condition known as thyroid storm, or we can say it as complication. It is life-threatening complication, state of severe hypermetabolism. Happens when someone stops treatment, develops infection or has surgery. All normal symptoms becomes exaggerated. Say heat intolerance turning into high fever, or increase in heart rate turning in cardiac arrhythmia, and many more. And without prompt aggressive treatment of thyroid storm, it could be often fatal. Now let's learn why. That means causes of hyperthyroidism. That could be Graves' disease, toxic nodular goiter, adenoma, thyroiditis, Jod-Basedow syndrome, neonatal hyperthyroidism. These all are primary causes of hyperthyroidism. First and very commonest cause is Graves' disease. In short, it is autoimmune disorder. Body's immune system reacts to thyroid gland and produce special protein. Here, say antibodies. That is, immune system, that means beta cells, produce antibodies against thyroid proteins. These antibodies include thyroid stimulating immunoglobulins, which binds to thyroid stimulating hormone receptors on follicular cells and imitate thyroid stimulating hormone. This results in growth of thyroid gland and stimulate follicular cell to produce excess thyroid hormone. Talking about toxic nodular goiter and thyroid adenoma, toxic nodular goiter, follicle starts generating lots of thyroid hormone and benign tumor makes excess thyroid hormone. Talking about neonatal hyperthyroidism, mother with Graves' disease starts generating too much thyroid hormones in response to thyroid stimulating immunoglobulin and crosses placenta and enters in baby. Thyroiditis. Anytime thyroid gets inflamed, damaged, large release of preformed thyroid hormones occurs and hence hyperthyroidism. Talking about Jod-Basedow syndrome, it is iodine induced hyperthyroidism. There is iodine repletion. Without adequate feedback control from pituitary gland, iodine repletion occurs. Secondary cause of hyperthyroidism could be pituitary tumor. Healthy thyroid that generates lots of thyroid hormone in response to thyroid stimulating hormone secreting tumor in anterior pituitary. Here I would like to stop. Diagnosis and treatment will be explained in next video which is coming soon. So stay tuned. Thank you for watching.